And welcome to TSPN. This is Supervisor Richard Forster. I'm going to go right into our Board of Supervisors meeting report for May 28th, 2013. Starting off today, we do have a short agenda as it looks on the agenda, but I know some of these items are going to take some considerable time. The first one will not, but it's very important. It's a presentation to Russell Tonzi on his 100th birthday. The Tonzis are actually from my district, but being very Italian, he's got a relationship with Ted Novelli, so Supervisor Novelli, Vice Chairman of the Board, will be making that presentation. I just thought some of the interesting things. He immigrated from Ticino, the Italian canton of Switzerland. In 1874, they purchased 160 acres. He was a charter member of the Amador El Dorado Sacramento Cattlemen's Association. He drove a freight wagon pulled by horses and mules, delivering supplies to the Amador County mines and to the Chicazola stores. So that's pretty interesting. And he remembers turning the crank on a shearing machine while his father sheared the goats. Now this is important because his brother John and sister Mary each had to take turns cranking for 10 goats, and there were over 100 of them. So there's some history there. He was married to his wife for over 57 years, and the secret to longevity is don't eat a lot of sugar. He takes a seaweed tablet every day, and he has a drink of Canadian Mist 3 or 4 times a week. So take that to heart. You can do it if you want to or not. So we'll go on from there. Next up, Supervisor Novelli will be speaking on this item, but Michael Sharp, the director of the Kirkwood Authority, will be giving a report on bringing power into Kirkwood. It'll actually be going from Salt Springs to Kirkwood Underground up Highway 88. As I was told by Supervisor Novelli, the limitation will be that it's only for Kirkwood build-out. It's not meant for anyone along the way, even though the underground is going to parallel Highway 88 all the way up, because the environmental community came in and made sure there were sufficient restrictions in place so that only Kirkwood could be served. To me, it doesn't make a whole lot of sense, but you know what? That's what people fight for sometimes, and that just means you'll either have to put another line in someday to service it, and that'll be more environmental issues. So probably a little excess capacity would have been a good idea, but that did not happen. Next up, we'll have establishment and evaluation of criteria for design of the intersection improvements at Fiddletown Road and Shenandoah Road. I'm not going to say a whole lot on this. We had this on our last agenda, and I think it lasted pretty close to about an hour and a half with everybody's ideas of how it should go, how it should not go. We're going to have Aaron Brustori in our second part of this segment, and I know a recent meeting has taken place to discuss that improvement scenario and how it might look coming up into this agenda. So we'll also cover that along with everything else with Mr. Brustori. Next up, we have a large issue that just got placed on the agenda from a meeting I had yesterday with the County Medical Service Plan. This is actually the CMSP County Medical Service Program. And the issue is that because of the Affordable Care Act coming in the first day of January 2014, implementation measures are already being put into place right now, and rules and regulations are being adopted at our state legislature. Most of them are promoted by the administration, the governor's administration, and most of them are for the purpose of capturing a lot of that money. What the administration is saying is that counties, you will not need that much money, and we're going to be performing those programs. So we are going to just come in and take that money right from the onset, even though counties are guaranteed through constitutional protections, through state laws, realignment dollars for health care, and even though the state of California, along with other states, gets a 3-year guarantee of the funds that come in from Obamacare or the Affordable Care Act. With that 3-year guarantee, there is no loss to the state, but they want to be the hog and come in and grab it all at one time. And That's not sitting well with Amador County. It's not sitting well with CMSP, the Medical Services Program, which has 35 counties in it. It's not sitting well with most counties around the state, that those realignment dollars and that those Affordable Care Act dollars that would have gone into other health programs in the counties are looking at being basically raided by the state of California. In 2013-14, this is for the state, the estimate that they're going to grab is $300 million that would be reduced from counties. 2014-15, $900 million in reduction. 2015-16, $1.3 billion in reduction. Those are the estimates. For Amador County, what does that mean? Close to $400,000 the first year. The second year, about $1.15 million. The third year, about $1.68 million. A lot of money that we could be spending on health care in our counties. And you know what? Maybe we don't need the whole amount. Maybe the governor is right on some of those areas. Well, then let's let the scenario play out and let's really see what's going to happen. There's a lot of unknowns. Right now, one of the biggest unknowns is the undocumented people that are in the state of California. At some point, it looks like the state is going to mandate them being covered for health care also. Now, right now, that mandate is not in place. If there is a mandate, who's going to cover that? Is that going to be counties? Is that going to be state? We know that a lot of the Medi-Cal patients will be covered by the state in the future, so there could very well be a significant savings to counties where they wouldn't have to cover those people. But we don't know on the issue of undocumented residents of California. We don't know the exact numbers yet on the Medi-Cal patients that the county will not be covering in the future. And we don't know if there's other costs that our public health will be covering in the future. The governor and his staff put together a position paper. Unfortunately, that position paper does not cover public health at all, which is one of the biggest areas that we are worried about in counties. You also have the California State Association of Counties that has been a supporter of the governor and tried to work with him on all of these issues. The first meeting that CSAC had with the administration, this was regarding the state option or the county option as far as health care. All counties, except for 2 or maybe 3, have said that the state option is the one that we should adopt because the state has been administering the program. They do a pretty good job at it. Why should you have 58 different county programs out there? When CSAC told the administration that they preferred the state option, the administration staff walked out of the meeting. Well, is that the way you want to do it? If you want to act like children, that's not the way to run government. You need to sit down and talk about the issues and see why people want to do what they want to do. But in our packet this week, which is late being put together because of the late notice of all this, counties are being asked to put together a position letter to the governor and to adopt a resolution which was put out by the Medical Services Program. This was done yesterday. The letter has not even been drafted yet, the template for counties to use. But one is going to say, don't take our realignment dollars, our health care realignment dollars. 2, we want to just wait the 3 years or wait at least a couple years, see how this plays out, and we are opposed to the governor's plan of coming in and raiding the health care realignment dollars. We're going to see how all that plays out. This is a huge issue for counties. It's one that will have long-term impacts. We already know that the cost of affordable care under the Obama plan is going to be much higher under projections than what was estimated at the onset. So we have a long ways to go on this, but right now there are subcommittee hearings taking place on budget in Sacramento, and the CMSP, the Medical Services Program, and all counties, CSAC, RCRC, are engaged and involved in that. Other issues on the agenda, we have a couple of public hearings that were pulled from the last agenda. Basically, these involve just a variance request and from our surveying department. and abandonment of public utility easements. The reason it was pulled previously is that the work that was asked to be done by our applicant was not completed timely. And the last thing on the agenda this next week on the 28th is Human Resources Department. This is a discussion on the County of Amador 457B plans, which is our retirement plans for our employees. We have a new company that has come in, ING, and wants to bid on that. What is normal, I guess, you would expect. ING found a lot of discrepancies, basically, in that employees were being overcharged on their plans, on the percentage fee that companies charge for management. Now, Great West Financial has come in and said, wow, we can reduce the price. We're going to reduce our management fee. Well, that's great after all these years of sticking it to the employees, and now they want to come in and reduce their fees. That doesn't sit very well with me. I'm going to see how it sits with the other employees. The Hartford is basically in the same shape, although Danielle Dix in our meeting at the administration level did say that she had tried to make some changes in the past, and we talked about that. So we'll have a full-blown presentation from Great West's Financial, the Hartford, and ING, and that'll occur next week. But what's going to occur right now is we're going to go to a break, and then we'll be right back with Amador County Community Development Director Aaron Bruce-Torrey.
You're watching Amador County's local television network, TSPN.